you never know if your board will support you in that, and you cannot do it without the board support. So, Jim, thank you, and thank you for the board. It's been wonderful and greatly appreciated. As a CEO, usually the week of the AGM is one of the most nerving weeks and the most important week of your year. And it's also the time that you want to brag and share the great things that the organization is doing. Make sure that we connect, but also make sure that we listen, because it's through listening to each and every one of you in the room and the 5,000 strong staff outside of the organization and our 10,000 volunteers and our external partners that helps us to understand what we do well, what we need to do better, and how we need to travel to continue to serve the needs of this organization and the country. So let me talk to you a bit about what we're doing, some of the amazing things, and we need to celebrate those amazing things. Recently, I visited Edmonton, and I had the privilege to spend time with Morag McLean. She's a VON nurse. Morag works at the Lorraine Shelter. It's a shelter for abused women where women find rescue and peace and support when they are in trouble. Morg joined us and started to work with those women, and she witnessed an interesting phenomenon. Many of those women were talking about how through their sexual experiences, strangulation was part of the normal practice. And they actually thought, many of those women, that that's how it goes. She was really struck by it and went to the literature to find out how to handle it. She is an experienced nurse, have worked in other settings, but this was a new one for her. She went to the literature and she couldn't find the material that she was looking for. So Morag said, this is not good enough. We could only afford her part-time. So on the days that she didn't work for us, she took her own time and worked on developing guidelines and protocols of how to manage and how to support women who are going through the experiences of strangulation. To make a long story short, that protocol that she developed and worked on with the support of others at VON is now being sought after by organizations across the country. And just recently, the Edmonton site received $25,000 for Morag to go to different organizations and talk about it. That's VON. That's the spirit of what we do across this country. Let me talk about research, and I think Ariella is in the room. VON used to do a lot of research, but it's fallen to difficult times because there were other challenges. A few years ago, we were fortunate to build our research office under the leadership of Ariella Lang, who is based in Montreal, so we can say we have some things in Quebec. And again, it's a success story. The number of funds that we've been receiving and the connections and the involvement and the leadership we provide around the research area in the area of patient safety, bereavement, and others is unbelievable. I go across the country and I hear about it all the time. For example, just recently we have received some funding from CIHR, and those of you who are not familiar with the acronyms in this country, that's the highest level of funding agency where you can get funding for health work. And this was for a scientific cafe, and the idea is to disseminate information and get others to practice. So we are interested in developing knowledge, but also make sure that it goes into the practice. And it entitled, Home is Where the Heart Is. Family members and caregivers are the heart of home care. And the purpose of this cafe will be to discuss experience, challenges, and insights regarding physical, emotional, and functional safety of family caregivers, primarily those that are receiving palliative home care services. Let me talk about the Aboriginal agenda. I talked about Monday afternoon, or Tuesday afternoon. The week is blurred. I was talking to my husband and he said, it's very cold. I said, I wouldn't know. I've been in the hotel since Tuesday afternoon, haven't stepped out. So that was Tuesday morning, and that's a picture at Health Canada when we delivered a report of 3 wonderful projects we have done with Health Canada for 10 Aboriginal communities in the area of home care, chronic disease, and quality management. Well, you know, you get contracts. That's okay. But what struck me at that few hours meeting is how what we have done with those communities became integral. Yes, we brought the expertise around home care. Yes, we brought the expertise around quality. Yes, we brought the expertise around chronic disease. But we have been able to work with those communities that it became absolutely culturally and otherwise relevant to their environment, to their unique situation. And we often talk about Aboriginal communities, but it's really 633 reserves and many, many other groups, and it's not one interactions. I was so proud to be the CEO of VON and see what we have done. It was just fabulous. We are well underway to build and innovate, and Jim talked about innovation. I hear from working very hard, and we are exhausted, and we're doing a lot of things. But at the same time, they want to continue to push because we all know why we're doing it. We want to make sure that we support and care for as many as we can. It is a marathon, and it's a marathon, and Jim talked about it, and I used to say in the beginning when I arrived to VON, it feels like taking Granny, who is 108 years old, and now it's 113, and we are making her run the Boston Marathon. It absolutely feels that way day in, day out. So as you talk to each and every one of the individuals in this room and out in the various sites across the country, VON today wouldn't be what VON is. It's nice to stand here and brag about it, but really the sweat and the scars and the hard work that everybody puts in is really done by every single person in this organization. And while our bodies are tired, our souls and spirits are soaring because we know that we make an amazing difference every day. Whether it's homemakers, whether it's nurses, whether it's IT, whether it's finance, whoever in the organization, I think what's so amazing, and we saw it the last 2 days also, is the absolute alignment of values and commitment and understanding why we are here. But our work is not done. As you know, we have been putting a lot of effort and financial resources to build a national organization that is befitting the 21st century. And we put in, as I said, a lot of sweat equity and resources that are limited and hard to come by. It is safe to say that we are close to building the backbone and spine of this organization. But the next stage of where we must go, and we are all excited about it, it's continuing to modernize our practice and tooling our care providers. And Jim talked about the mobility, that we're looking at clinical mobility systems, we're looking at care and service models, we're looking at magnet approach, and those of you who don't know what magnet is, it's really the diamond symbol of absolutely excellence in care. And Sharon Gooden leads that initiatives for us in many areas, and you can talk to her more about it, and her team are tirelessly working on making sure that all of our men and women have the tools and the knowledge and the ability to make sure that we deliver every encounter the very best care we can for our clients. If you look at what we have been able to do and we're continuing to do with the H1 and N1 and our pandemic plan and many more examples, you will quickly realize that VON is delivering on the promise to the nation.